So recovering from a pec major repair, or in my case, a pec major reconstruction with a cadaver tendon augmentation, is really simple if you can just follow the script. So the script here is peace and love. So if you're ever heard of RICE or PRICE or POLICE, which is like rest, ice, compress, elevate, or protect, rest, ice, compress, elevate, etc., and then police, those are very outdated. Instead, we use peace and love. So I'm post-op 1 week now, and I want to tell you a little bit about what I've been doing to manage my recovery and how to catapult myself in the future so I can make sure that 6 months from now, this is all nothing but a bad memory, okay? And if you follow the same script, it's gonna be the same for you as well. I'll walk you through, peace and love and how that entails and what that looks like in real life. So first and foremost, peace is the subacute, okay? So the first 72 hours. And then love is really 72 hours and beyond. Now, this is not peace is only the first 72 hours, and then love is 72 hours and beyond. It's peace is the first 72 hours and beyond, and then love just starts later at 72 hours and beyond. So let me walk you through. P is protect. Very first thing you want to do is protect the surgical site, okay? Which means following the surgeon's instructions, not moving, not actively doing anything. Don't put your arm in a position that you shouldn't be in. Okay, having a good sling and maintaining those protective ranges, those safe zones, A, B, and C, are hugely important. So in this case, what I want to do is I want to make sure my arm doesn't travel behind me. So one way that I'm going to do that is if I'm sitting, that's no problem. It's going to be kind of rounded a little bit forward. But if I'm laying down, I need to support my arm and have something under my arm at all times. That way it is, I'll show you on this side because I control it, slightly elevated like this, okay? So that way it's going to take some of that stress off. That's number one. So that's one way of protecting it, okay? Keeping myself from anybody hitting me. Of course, wearing a sling helps other people know that, hey, something's probably wrong. Me, I've actually found it's been far more comfortable just not wearing a shirt. The tissue and everything was just kind of irritating, so I just found that not wearing a shirt was actually just better, so I just haven't been. So that's P, okay? So you want to protect it. E is elevate, okay? So you want to elevate. One way that you can elevate, right? So I can't actively elevate my arm, right? The idea is to elevate it above your chest, right? Above your heart. Well, what that looks like in your heart or in your shoulder is that means your shoulder just needs to be like above and elevated. So commonly, if you've ever had a shoulder injury, if you've ever heard somebody who had a shoulder injury or a shoulder surgery, one thing that we'll find is sleeping in a recliner or even upright is better. Reason being is if you're laying down, all of that irritation, that inflammation just settles, and it creates like a deep ache and a throb, right? So it starts with a deep ache, and then as it just settles there and it just is accumulating, that's when it sort of turns into that throbbing sensation. It kind of feels really hard to kind of come back from. So by staying in a semi-elevated and recumbent position and being in a recliner, that actually can help maintain its elevated. And again, even when reclining in a recliner, you want to make sure that you are protecting that arm and keeping that arm slightly elevated. You can use a pillow, or you can use like the abduction pillow that they give you, such as this. This is one thing that I've used in a pinch. If not, you can go ahead and use a pillow. Either one will work just fine. Okay, so that's E. A is avoid anti-inflammatories. So after a surgery, it's really important that surgeons will always give you pain meds and narcotics, but not anti-inflammatories. Here's why. Pain meds, right after the surgery and such, we take pain medications to mitigate the pain, right? And mitigate that pain response. However, we want the inflammatory cascade to occur. So what that looks like is anytime we have an injury, right, a trauma. Okay, now surgery is trauma, controlled trauma, but it's still trauma. So we have trauma, okay, and then that is going to create inflammation. Inflammation kickstarts the inflammatory cascade, which is what allows for healing to occur. So if we just had this surgery, this trauma, and the surgeon, is scraping the bone and doing what they're doing to create that bleeding, that inflammatory response, and we take anti-inflammatories, we're literally counteracting what they're trying to do. And you don't want to do that because that's, again, just going to delay your healing. So you take the pain pills, so it brings the pain levels down, and you just kind of protect it and follow the steps. Now, that also includes ice, okay? Ice is another thing that people a lot of times will use for pain relief. For all of my clients, we highly recommend that they stay away from ice. I am now post-op 1 week. have used 0 ice this entire time. Even immediately after the surgery, they didn't put any ice on me. A lot of times I find surgeons and professionals recommend ice because it's kind of like the old adage. It seems simple. People want to feel like they have a way that they can help themselves and try to take care of some of that pain. But I promise you, if you can get away from without needing it, don't use it. It's going to help. It's going to help speed up the process. So when would you ever use it? I'll start here for a minute. For pain levels, we can kind of break it up into 3 categories. If you know the pain from 0 to 10, 10 being the most severe pain that you can imagine, and 0 being none at all. We have 3 boxes that you're within. Okay, so you have mild, which is 0 to 3. Okay, you have moderate, which is 4, 5, and 6, and then high, or high reactivity, high irritability, 7, 8, 9, 10. The goal with pain medication and such is not pain elimination. Okay, it's pain mitigation, right? We want to mitigate it from getting to be too much, right? That's the whole idea. Like, it's expected that you're going to have a little bit of pain and that you're going to have to push through some of that pain. So when and where? Well, you want to be within the mild and moderate. That is where tissue healing occurs. When it gets into that high level, that is when you're outside of that therapeutic window. So a lot of times in therapy, like later in the stages, people need to be between that 4 to 6 range. We don't want them to go any higher than that, but that's where you need to be at, to be pushing yourself hard enough in order to continue that inflammatory process, to allow that inflammatory cascade to continue the healing process. Now, you shouldn't always be in that 4 to 6 range. That's only going to be with movements and such, with the active exercise that they're having you do, and then you should kind of go back down into that mild range, if you can imagine. Mild, moderate, and high. You want to kind of be here when you're actively doing stuff, and then your pain pills and such should always be bringing you back to that 0 to 3 range. And that's exactly what I would tell people. Any of my patients, I kind of tell them, unless you're 7 or 8 and above, try and stay away from it. That's what the data shows. That's what the history has shown. I've seen people even come post-op, hip replacements, knee replacements, not doing any ice or anything like that. So here's a token. I haven't used any ice whatsoever, any anti-inflammatories either. So that's A. Then you have C, which is compression. So in my case, if you're familiar with those like compressive socks that you get right after a surgery because they don't want you to get a blood clot or DVT, I had those on. I was supposed to wear those for 3 days, and I did. Sometimes you will get them up to your arm. They decided not to do it on this one, they were saying, but just to be mindful and just try to keep them in and flexing your arm and moving it like this. That way it's circulating, coming up and down like that. So that's what I did. But you can have those compressive sleeves on that, and that would be that case. And then E is that last one, is education. Okay, and that is to educate on not only what to do, but more importantly, what not to do in this case. So, for example, one thing that I want to do is not go run, right? You wouldn't go run or do anything that would jeopardize or put yourself in a position like this, okay? But to educate on pain science, what to expect, how to move, how to safely move, and things like that. Now, luckily, as a therapist, I didn't need any of that excess education, but kind of just educating what's going on. This is where I generally, if I'm ever working with a client, I always recommend they go and get that op report, get their physical op report, call their surgeon, call the office, say, hey, can I get the operative report? I want to see exactly what you did line by line. And if you have therapists like any of ours, we always go through the whole op report with the patient, show them exactly what's going on. If the surgeon doesn't do that already, if they do, that's fantastic, and they should be a perfect person to go ahead and do that. But having the education of knowing what went on and why you shouldn't do the things you shouldn't do is important to help give an understanding to helping you with that recovery and moving along. So that's been peace, okay? And I know I'm wrapping up on a little longer one, but if you're staying with me so far, that's the first 3 days, and then continuous, because you want to maintain those, and then now moving on to love. So after about 3 days, at this point I was able to switch from the oxycodone to hydrocodone. I wanted to be able to get up and move a little bit more and such. So L is load, okay? There's many ways to load this, okay? Even though, I'm not gonna sit there and do like bench press or actively moving, there's ways that you can load things. So you can contract the muscle, such as this, that loads it, as well as pulling apart, that's loading too. One's compressive, and one is a pulling, okay? There's many ways to load. Other ways to load are even just kind of like softly massaging. Believe it or not, this like softly massaging and such, that is loading the tissue. That's exactly what I'm doing, is I'm giving a little bit of a stimulus for it to go against, right? And that's how it's going to heal. And I'm trying to train it to remodel the way it needs to. Because when the body lays down new tissue, it lays it down irregular. Okay, it's just disorganized in an irregular fashion. Reason being is it wants to be as strong as possible as quickly as possible. We need it to line or be aligned in parallel fashion, right? Every tissue, right? We want it to be in parallel fashion to those fibers. Now, the only way for it to go from disorganized to organized in parallel is we have to load it. Okay, we have to give it the appropriate load so it remodels that way. And so in this case, because I can't actively like really stretch or strengthen it, then I need to just give it as much load as I can. And some of that may just be kind of like little shoulder circles and such like this. Okay, just a little bit of motion, just a little bit of load. I'm doing an appropriate amount of load that I should be doing at this moment in time. O is optimism. Okay, it's tough, right? So it's tough feeling like, oh my God, I used to be able to do this, now I can't, yada, yada, yada. What we know is those who have a more optimistic outlook, it's so much better for your entire rehab. You're just gonna do a whole lot better. Okay, so stay optimistic. You are gonna get better. If you do everything right, 6 months from now, this is just gonna be a bad memory. Okay, so just follow the steps. I promise you're gonna be exactly where you wanna be. V is vascularization. Okay, it's just a fancy way of saying blood flow. The healing properties are in the blood. Okay, so if you ever heard of PRP, right? PRP is platelet-rich proteins, okay, or plasma-rich proteins. Okay, and so what they do is they withdraw your blood, they spin it around the centrifuge, and then they take just the white part, which is your platelets, and then they inject it. Okay, what that is just a higher dose of healing properties in your blood flow. Well, if we just naturally send blood flow to that area, we're gonna get it there. Okay, so another way that we can send blood flow to an area is just general movement. Okay, because I can't move my arm, I can't do the things I want to do. If I'm just up and around and moving, that's going to help circulate and get some of that vascularization, that blood flow circulating. That's exactly what we want. And then E, and last E there, is exercise. And this is general exercise. You want to be able to get started with a general exercise routine as quickly as possible. Going back to the E, it just allows, number one, for blood circulation, getting some of that gunk out to your lymph nodes, circulating some of that good blood flow all around. It's just all-encompassing. It's going to help. Number two, it gives you a little bit more of those endorphins, and it makes you feel a little bit better and allows you to start focusing on the things that you can do rather than things that you can't. As far as exercise, there are direct exercises that you're going to do as far as exercises that you're going to do for the time being. For example, an exercise you're going to avoid. So for example, one exercise you're going to avoid, you're not going to run, right? Because if you're running, your arms are going to be like this, you're going to be stressing it, you're going to be too much pressure. You're not going to ride a bike where you're holding on to it because that's going to be contracting that muscle, okay? You could do, like me, I just like walking, okay? So I'm walking, just getting a little bit of fresh exercise and such like that. That'll be great. Probably in a week or so, probably start doing some like unilateral work over here, maybe some squats and stuff like that without any weight or any disruption here to allow this to heal, but just start focusing on the other areas of my body and such. That's one thing that I'm gonna do. Beyond that, you want to start doing some exercises, like I mentioned, passively moving your arm up and down, and then you can start moving it up and down like this, moving your wrist and keeping all those motions such. Those are the exercises you can do at this point. Your therapist, if you have one, and I highly recommend you do, should be guiding you through each week what you should be doing from here to shoulder circles, all the way to scapular motions, to pendulums, to any active, passive, and active assisted range of motions, and all the things beyond. Now, as you can imagine, even if you're 2, 3 weeks, 4 weeks, or even a month out, that same piece still holds true. Now, you don't have to protect the surgical site the same as you did at 2 months or at 3 weeks, the same as you did day 1. Okay, but you do need to protect the healing that has occurred so far. So it's a continuous thing where you're continuous to protect what you have made. The gains that you have made so far, you are continuously going to protect that. And you do want to keep it elevated if it is too irritable. This is why sometimes people are sleeping in recliners for another 6 weeks after a surgery like this, or after a rotator cuff repair. They'll do that because they need to keep it elevated. If not, that blood just sort of pulls and it's just throbbing, it's an ache, and it's very uncomfortable, and that's the only way you get a good night's sleep. And as we know, sleeping is going to be one of the best things you can do after a surgery like this, because that's where all the healing and everything's going to occur. So I hope that was informative. I know this is a little bit longer than I normally do, but this is where I'm at. Post-op 1 week, I'm really excited. I'm very optimistic what it's going to look like moving on forward. So I'll see you in the next one.